Hello, everyone, and welcome to this session of AAC in the Cloud. We're excited to have you here on the live session. And for those of you that have been here this morning, it has been an exciting day so far. We've had a little bit of technical adventure, but I think we've got things straightened out, so we should be in good shape. Today I have with me Kathryn Helland, and she has been part of AAC in the Cloud for a while, and we're really grateful to have her. Her topic today is emergency planning for AAC users, so something very applicable at the moment, and we will turn things over to her.
Hello, welcome everybody. Let me share my screen with you and find. Okay, for some reason, PowerPoint is not showing up in my choices.
Oh, there you go.
Here I go. Okay, I'm going to pull it up.
Looks like you've got it, I think.
We're good.
There we go.
Okay.
Nice work.
As we like to say at Tech Allen, we do stuff. Tech happens. And it looks like Temple University has sort of taken tighter control over documents and things created through Temple software. So some people are having trouble getting the PDF download. We will make sure to make that available to you. And at the very least, later today, I will post that PDF with a slide deck on our AAC website, which, if you're not familiar with it, is aaccommunity.net. And a lot of the resources, not all, but some of the resources I'm talking about today are going to be referenced in other articles, or referencing other articles on aaccommunity.net. So hopefully you'll have a chance then to go over and take a look at the website, take a look at sort of the smattering of blog posts and articles that we have there, and let us know if you see something missing that you'd like us to write about and you'd like us to put up there. So my name again is Kathryn Helland, and you have my email address here. So feel free to touch base with me after the session if you wish. And that very tired looking photo, I took a walk a couple of weeks ago. Here in Yardley, we have a canal path on the Delaware Canal, and most people are being very aware and cognizant of social distancing, but not everybody. And I am very careful. As soon as I think there's any chance I'm going to be less than 6 feet away from somebody, I put on my mask. And I try to be very respectful because, as we've all heard, my mask protects you and your mask protects me. And what a world we live in right now with COVID-19. And so that's how I chose the title of my session, emergency preparation, not the emergency we planned for, because so much of e-prep, or emergency preparation for people with AAC and disabilities, has targeted other types of emergencies. And COVID-19 has proved to be very, very different. So why do we need to discuss the issue of emergency preparation and AAC? Well, for one thing, communication is a human right. Communication is always important. Communication can be extra important when we're facing an emergency situation. And that could be any type of emergency. We have to respond, we have to interact with, in many cases, frontline people, emergency responders. We need to be able to be understood. We need people to see us and to respect our way of communicating and take it seriously. And we need to be seen as competent human beings capable of engaging in that communicative give and take, in making decisions about where to go, in making decisions about medical communication. All of those things are super, super important. And people with complex communication needs can be extra vulnerable during emergencies. There's a lot that happens. DME, durable medical equipment, or iPads might be left behind, might not be seen as important in the case of an evacuation from a location, or in the case of entering into medical care. Sometimes after an emergency, you might have the need to repair or replace equipment. Equipment might be destroyed. You also need a way when you enter into emergency medical care to be able to give consent, to be able to talk about what's important to you, to be able to advocate for yourself and receive the medical care that you deserve when you enter into medical interventions. So e-prep is very definitely important for AAC. And given the world that we're in right now, I didn't have COVID-19 in mind when I first proposed this type of session to AAC in the cloud. But given the world that we're in right now, I'm going to talk about things that we can do to respond during the current pandemic and the current emergency that we're all dealing with on one level or another. And then I'm also going to talk today a bit about more traditional ideas for emergency prep and the kinds of things that many of which are going to overlap between what we're facing today that we hadn't planned for and what typical emergency prep looks like and does plan for. So what did we plan for? Most emergency planning, and TechOwl has been involved in some of this planning with the state of Pennsylvania. We've thought about forest fires. We've thought about floods. We've thought about earthquakes and hurricanes. And these disasters do take place on a regular basis in pretty much every state. Pennsylvania, I think we had a hurricane a couple of weeks, not a hurricane, but a tornado a couple of weeks ago. And there's nothing that says that we don't get double whammied. So there's nothing that says that just because we're already stressed out by the pandemic, that we won't also face other types of emergency situations. And emergency planning is typically looked at a situation where you have something that hits an area like a flood, and my town, Yardley, is prone to flooding down by the Delaware River, and you have to take people out of that situation, evacuate them, and get them into shelter type scenarios. And a shelter where somebody might or might not have access to their durable medical equipment, their wheelchair, their other mobility equipment, their hearing equipment, their AAC, their augmentative and alternative communication. And with COVID-19, we're kind of in the opposite situation, where instead of having to shelter together and move away from a particular location, we're sheltering apart. We're sheltering in place, either as individuals or families or congregate settings like nursing homes or group homes, community living arrangements that we find a lot of adults with intellectual disabilities or developmental disabilities facing life in those settings. And that has been a very, very challenging situation with the current pandemic. We know that a lot of those settings in which adults with disabilities have found themselves in have been very, very vulnerable to infection and to the spread of the SARS-CoV-2 virus. Okay. So in the time of COVID, as I was saying, we're not sheltering in large disaster, prepped shelters. We're sheltering in place. This means that people with disabilities are facing a load of social isolation and lack of interaction, and potentially also for our AAC users out there, a lack of people who are aware of their device use and may know how to interact with them using their devices. And it's got to be a really, really lonely time. I am so fortunate to be sheltering with my family, with my husband and my two sons, one of whom has autism. And we have just the right amount of space. We don't have a big house, but we have enough space to be together when we want to be and to get out of each other's ways when we don't want to be together. So that's been a really positive thing for us. But in terms of people, especially thinking of that paradigm of the group home, you've got isolation you've got a lack of interaction in the community or the day program or whatever setting you were used to going into, a vocational setting maybe, all of that's done. So daily routines are totally interrupted over a really extended period of time. And for all of us, this has been so incredibly hard because we can't predict exactly when it's going to end. We simply don't know. We know we're still in the first wave of the pandemic, and we know that some states are really facing a rise in cases. We know that where I am in Bucks County in Pennsylvania, cases have largely gone down, but there are still new cases being diagnosed. So it's not like it's gone. It's still here, and we still don't know how long we're going to be dealing with this because we don't know exactly when there will be a vaccine. And we certainly don't want to be in a situation where everybody gets infected and we develop that herd immunity through the sort of rampant spread of this virus. In such a case where there isn't a vaccine and people are just getting infected out in the community, we know that people with disabilities are oftentimes incredibly vulnerable and have not always been taken into consideration in the very last minute emergency plans that we've seen develop in response to this crisis. So when hospitals in New York City began to become overwhelmed, also in states like Pennsylvania and Connecticut, there was a real question as to whether or not people with disabilities were going to be perceived as eligible for ventilation or eligible for intensive medical care if there was some kind of a triage situation. And my sister-in-law is a nurse practitioner. She's at Mount Sinai Hospital on the Upper East Side of Manhattan. And so we've had a bit of an inside view of what's gone on in places where the virus has had broad community spread, and it has been a horrible, horrible situation. They were setting up tents in Central Park. They were setting up the lobby. The Starbucks was gone. It was all hospital beds, and people were dying. And a lot of those people who entered into hospital settings suddenly found themselves unable to communicate. So the communication issue has hit a very broad group of people who ended up being hospitalized with COVID-19, and not just people who were AAC users or already had limited spoken communication abilities. So loss of communication during hospitalization has gotten some attention because it has hit a broader population. And then on top of everything, of course, we've had major economic disruption, which has meant that so many people, 13, 14% are now out of work. And in terms of my own family and impact, my son, Matthew, was in the midst of working with OVR to get a job. And the OVR office closed and couldn't continue his services. And his OVR counselor then went on leave. And so he's sort of stuck in a limbo, which is, I think, a good metaphor for how we're all feeling at this point in time. So what can we do? What can we do to help AAC users prepare for what we're going through and to address the needs of people that we see right now? And lots of C's in this. In response to COVID-19, we need to continue thinking about communication for care, for connection, and for continuity. So one of the first things that we developed at TechOwl in response to COVID-19 was a need to know form. So this is a form that if somebody's becoming ill, they can fill out, or somebody can assist them in filling it out. And it doesn't just have a medical diagnosis or a disability label or diagnosis. You can put in there your name, your medications, your allergies, but also your language, how much you understand everything, some things, very little, how you express yourself, what kinds of questions you can answer, how you express yourself, whether it's typically verbal speech, a device, American Sign Language, gestures, or paper and pencil, and then other information such as, what is your family like? What hobbies do you have? What kind of work do you do? What is your religion? And also what sensory loss or sensory issues you might be dealing with. We felt it was very important to put the lifestyle information in there because we want everyone to be seen as a full human being, as we should be seen. If we're suddenly thrust into a hospital setting and it's perceived that somebody has a disability, we don't want that to be seen as a reason to dehumanize and to deny care. And I think this is still important. The East Coast is in better shape than it was a few weeks ago, but we still do see other areas of the country, such as Arizona, Arkansas, California, Florida, increasing their numbers and rates of COVID-19. And we know that people with disabilities are going to be in harm's way. And we want everyone to be seen as a full human being deserving of care. And this has been a legal issue as well. And I know that the broader Institute on Disabilities at Temple University has worked with Disability Rights PA to make sure that medical settings can't triage people with disabilities out of care and that they get the care they deserve. So fill out this form. It can be pinned to somebody's shirt. Make sure it gets with them to the hospital, because that way, not only does the doctor or nurse have a lot of actionable information that they can take into account. Oh, this is a person who really likes to knit. This is a person who really likes to play video games. Whatever it is seeing them more fully as a human being. But also, it's a good adjunct to having other types of communication with you in the hospital. So you've got to have a way to participate in informed consent and in your medical care. And one of the very first things that we did at TechOwl in response to the COVID-19 outbreak was to develop a medical communication board. This is fully available for free on our website. If you're in Pennsylvania, we do have some laminated copies that we can send to you. I think we still have several hundred of those left. This is your basic core vocabulary board, but at the bottom of it, we added on a row that was COVID or medical treatment specific. And it's got things like icons for COVID-19 or for doctor or nurse, for headache, for cough, for breathing, for being hot, for needing medicine or needing to use the bathroom. So when you combine those icons and those words with the core vocabulary that's up above, you have a one-pager that's a fairly robust communication system. And what you can't see in this slide is on the back of this page is a QWERTY type keyboard, so that people who are usually typing text to communicate will still have that familiar motor planning for typing text and can still get in there and communicate with a communication partner who's there to listen to them. So please make use of this. It's one of a number of different communication options that are out there right now. Other types of medical communication that are available. We've got Cough Drop that worked with the AT Makers folks and put together COVID Speak. And I've got the website right here, covidspeak.org. And this is a video interface. So you can actually talk with somebody on an iPad. You can use the communication icons. You can go from quick communication to some customized communication. You can also use emojis for reaction and for the emotions that people go through when they're hospitalized. And this is a way to get people connected through a video chat in those kinds of urgent care situations. So an excellent tool. Check out the website, check out what they've done, and take a look at how that can be used in medical settings. And I just keep thinking that to use any of these things, you also need a communication partner who's got the time to be there with you. And so if you're facing hospitalization, fight for the right to have your communication partner there with you, because we know that that has been an issue. And there have been some legal settlements in states like Connecticut to say that, yes, the person with a disability is entitled to have a partner with them throughout their stay to help facilitate that communication. Okay, other communication boards that are out there. We've got patient-provider communication has set up a set of boards, general needs communication boards, pain scale boards, yes/no boards, as well as letter communication boards. So for me personally, print out and use the TechOwl one, take a look at the patient provider communication website, see what you like best, see what's going to be most useful for the person that you're supporting or for yourself if you're facing potential hospitalization, and take it with you. If you're going to have just the paper copy, take a bunch of copies with you, because you might use it once and then have to throw it away in order to be respectful of sanitary needs. If you have the ability, then do laminate it or cover it in contact paper or cover it in clear packing tape. Do what you can so that it can be basically waterproof and that you can wipe it off with a Clorox wipe or something in between uses, and that it can be reused. So there are a bunch of choices out there now. And I know also Practical AAC has a bunch of really great posts with different communication resources for people during the COVID-19 pandemic, including a lot of social stories targeting things like wearing a mask or washing hands or why can't we go outside. Let's also think in the current setting about communication for social connection. Loud airplane overhead, sorry about that. So just that whole idea of having video chats. We've been doing this at TechOwl. We've been taking advantage of the Zoom platform. Thankfully, Temple got licensed for Zoom sometime last fall, so we were already up and running with it. And we've been holding bi-weekly video chats called AAC meetups for some of the people out in the community that we're connected with. Anybody is actually welcome to join us for those video chats. So contact me if you're interested. And we just use the Zoom platform. But if you're isolated or sheltering in place and you just have a smartphone or some other device, there are a whole bunch of apps that can be used, including House Party, including your typical ones like Skype or FaceTime, or Facebook Rooms are now a thing, Google Duo, Google Chat. There are a whole bunch of different tools. Find the one that works best for your team. And a bunch of those tools, unlike FaceTime, are cross-platform. So if you have a group of people communicating with each other, and some are using iPhones, and some are using Android phones, and some are using Google Pixels, whatever, you can still use the apps and get together and communicate with each other. And we found that in doing video chats, that it was helpful to really think about a few basic ground rules, depending upon the number of people who are in that chat. One thing that was kind of facilitated just by the platform of using Zoom is the wait time, because it's not kind of your typical face-to-face communication where all your abled verbal people are just going blah, 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 and just talking and not taking wait time. Zoom kind of facilitates or encourages people to sort of wait and look whose box is lit up, who's talking at the moment, but we can also be conscious of that and making sure that we're providing that wait time for AAC users to be part of the connection, part of the conversation, and have that chance to participate. It also kind of helps if people raise their hands or use the hand raising emoji to talk with each other, because you know what? A lot of our AAC users at the meetups are guys, and most of them have the Ryan voice. So if everybody's trying to talk at once, we're like, okay, I heard you, but I'm not sure which one of you it was. So Zoom does light up the box around the person trying to speak, but we felt it was also helpful to give some kind of either digital or physical hand wave to say that you were trying to say something, that you had something to say, and then help make our conversations a little more respectful of all the voices that were out there. So there is an article on aaccommunity.net, and it does have within it a bunch of the apps listed and the platforms that those apps work on, and also some of the privacy settings or possible encryption and accessibility settings that are available to work with those different video apps for connection. And just on a personal note, before any of this started, back in early January, we got my mom an iPhone. My mom is on the Upper West Side. She's turning 81, and she has a disability impacting her breathing. And we didn't know the pandemic was coming, but we got her set up on FaceTime. And that has been a literal lifesaver because she's all by herself. She's in an apartment and she can't go out very often. And for the first few months, she didn't go out at all because she is so vulnerable to infection. And so just having that connection by weekly family FaceTime chats has been absolutely vital. I think it has really saved all of our mental health, but hers in particular. Other things that you can do when you're trying to participate in this kind of social time via video app or Zoom is that you can structure that time a little bit if you feel like you need to. And we've done this during our AAC meetups. So some of them we just leave for conversation, especially after the death of George Floyd, after the protests started, and everybody just needed to talk. And there was a lot of time just to be able to talk. But at other points in time, we have also used games. And games that were not too childlike, but games that everybody could participate in, whether they used their spoken language or whether they used a device. And those games were actually helpful for some of our newer AAC users because they provided a way for people to explore their devices and potentially find vocabulary and figure out how their vocabulary set is set up. And that was the case for some of our users at AAC meetups have just transitioned to new devices. And so that exploration was working for them. And it could be a game as simple as, okay, let's all come up with something that starts with the letter W. It could be using an app and playing a game of Heads Up or 94%, where you're answering questions and making guesses about, who has what character on their head. It could be using a platform for your video chat like House Party that has built-in games and allows you to choose and play those games. I think the Facebook rooms also have that ability to choose and play a game as a group. So that can be a good way to also maintain those ties and feel a little bit less socially isolated. I know also some video game platforms have that built-in connection to other players around. It can be really anywhere in the world. So, for us in the template that we've sort of put together for our meetups, we have found that we've really gone back and forth. So one week we might talk for 40 minutes, and then we might do a Kahoots quiz for 20 minutes. Other weeks when we need to talk about what's going on in the world, we just talk and we don't play games. But it's a pretty good option for when we're doing video chats. What else can we do to sort of get out of our homes and out of our sheltered areas and be part of the world? What can we do if we're an SLP and we're working with a young or new AAC user and we want to have something to talk about? Certainly the four walls that we've all seen for the past 14 weeks are getting a little bit boring. So we put an article on AAC Community about webcams, because there are webcams that can take you almost anywhere. And there are webcams that will take you to the panda cage at the zoo. There are webcams that will take you to, I think, the International Space Station. But there are also some websites that are sort of meta. They're like webcam websites that will take you to webcams for train yards, webcams for harbors, webcams for other types of settings, for nature. And you can take a trip on your computer, go visit those places, and then you've got a lot to talk about. And if you're a partner supporting a new AAC user, you've also got a lot to model about. So we put that out there as a resource for people just when you need to get outside of the space that you're in. And of course, in doing all of this, we want to be very aware of keeping things clean and making sure that if we are sharing devices, excuse me, or sharing computers, that we are making sure to do cleaning procedures that are going to make sure we don't risk spreading any viruses to anybody else. And you can actually use a Clorox wipe to clean your iPhone or to clean off your iPad screen. But there are other steps you can take as well. And we put an article on techowlpa.org that lists a lot of those protocols and procedures for keeping things clean so that we can all just be as safe as possible. And I would just urge everybody to err on the side of caution. So even though some of the news articles these days are saying like you don't have to wipe down your groceries and stuff, I'm still that crazy person who's taking my Clorox wipes with me to BJ's, and I'll use a wipe to open up the freezer compartment to get out my milk or my eggs. And you know what? Somebody else might think I'm a little cautious, but that's okay. That's their problem. I'm going to be as careful as I need to be. So resources for cleaning your tech, it's out there. And this also impacts Tech Owl as an organization because we run a lending library. We send devices across the state of Pennsylvania for people to try out assistive technology before they buy. And we are very, very careful about how we clean our devices and package our devices before we mail them out. Excuse me. So here are just some other links for some more resources that you can access for information about communication and social stories and other things that you might need during COVID-19. Resources are always good. And now I want to talk a bit more about traditional emergency prep and some of the things that we've always had in our planning. And some of it's going to be relevant to the current situation, some of it less so. But again, keeping in mind that we're entering hurricane season, we're entering the season when tropical storms can hit the Gulf Coast or hit the East Coast of the US. And just because one bad thing has happened doesn't mean another bad thing can't happen. So I would urge everybody supporting people who use assistive technology, and especially AAC in this particular case, to consider creating a Go Bag. So you can get a red backpack or any particular bag that you happen to have around your house, and there are things that you can put into that bag and keep it somewhere in a safe, predictable place near the exit from your house. And things that you would traditionally find in a Go Bag would be things like change of clothing that's going to last for 3 days, change of copies of your scripts, copies of bottles of your medication, water for 3 days. If you're traveling with a service animal, supplies for that service animal, and anything that that dog or other animal might need during that 3-day period of time. But what about our AAC users? Well, if there's any risk that you're going to suddenly have to vacate your premises, you should have copies of your AAC insurance report if you have one, and or the warranty for your device. Make Xerox copies, laminate them, put them in pocket protectors, put them in your Go Bag. Because there have been too many cases in Puerto Rico, in Texas, and other areas where storms have hit and people have been without their devices, but also without the proof of their insurance coverage or the proof of their warranty for those devices. Also, take the time to back up your vocabulary set. If you've done any customization, back it up and save it. If you're using an AAC device that's kind of a dedicated communication device, maybe a NovaChat or a Penky Accent, then there's the likelihood that you can back things up to a flash drive. Put that flash drive in a waterproof Ziploc bag in your Go Bag. If you're using an iPad-based communication system, you are likely able to back that up to the cloud. And we do have an article in AAC Community that talks about just the basic steps for each major AAC app for getting that into the cloud. So do you go to an iShare account? Do you go to Google Drive? Do you go to Dropbox? Set that up ahead of time, get it back up into the cloud, and then also make sure that you're dating each backup of your vocabulary set so you know what's most recent and you know which one to download when you are in the situation where you have to replace somebody's vocabulary. But you can also have light tech backups. Having a light tech copy of your AAC system, whether that's something you print out from the manufacturer's website or something that you screenshot on your iPad and then print out and laminate, have that with you. Or at the very least, add a copy of the COVID-19 Medical Communication Core Board to your Go Bag. Or at Temple University, we also have Emergency Communication for All core boards, which are not COVID specific, but they can be printed out in English, Spanish, French, and also Haitian Creole. And those can be stuck in a Go Bag and forgotten about until the time when you really need them. And then when you're faced with first responders and you can't communicate, either you can point to the icons or you can work with your most familiar communication partner and do some partner assisted scanning and be able to interact and talk with those people. We're talking about tech, also have a really good power bank. I have a huge power bank that charges my iPad about 5 times. It's a lot bigger than I thought it was when I ordered it on Amazon.com. But you know what? 2 weeks ago, we had a storm come through here called a derecho. The derecho is like a tornado, except it's straight line winds. And straight line winds of 90 miles an hour hit my house and our power was gone. And we didn't get power back for, it wasn't too bad, but it was about 3.5 days because the transformer on the pole right outside of our house got hit by lightning. And so we were out of power. And my husband, when the whole pandemic thing started, he thought I was nuts. I was racing around, charging everything, charging up all my power banks, getting everything ready. He thought I was just a little bit overcautious is perhaps a better word to use. And boy, did we use those backup batteries. We used them up before we got our power back. And make sure also in your Go Bag that you have copies of any scripts, that you have copies of any scripts for medication you need, and also ideally a 10-day supply of your medication so that if you do have to leave your home, you're not stuck without. And this is something where I should actually myself do as I say and not as I often do. I do have extra medication, but it's not in a Go Bag, I must admit. But when the pandemic hit, I was very aware that supply chains might be interrupted. And I did ask my doctor for extra refills on the medications that I personally take. This is a way to reference that AAC Community article on backing up your AAC iPad apps. So again, go to that article, take a look at how to back up the particular system that you use and make sure you have that copy saved in the cloud. The light tech backups, we have another article on aaccommunity.net, which has links to the light tech core boards for most of all the major language systems. So we have Speak for Yourself, we have LAMP, we have Touch Chat, we have links to Proloquo to Go core boards. So if you don't feel like you have the resources to screenshot and export those pictures, go to the website, take a look at what's offered by the manufacturers. And then if you even, you can always MacGyver it and tape over some of the symbols or over some of the pictures to add your personalized icons or photos to that system. I've even sometimes used those little tiny portable printers that are they're really created for the social media world, but I've used those to print out pictures. And then I've used the kind of laminated pouches that are self-laminating that are used for business cards. And I've used those to actually then put the new symbols or icons into a LightTech book and laminate them. And so you can use what comes from the manufacturer or the vendor, but still be able to customize it. Here's the emergency communication for all boards that I was talking about. They're on the TechAL PA websites, but you can also just Google it. Emergency communication number 4, all, and let's say Temple, and you're gonna come up with the links. And we updated these boards a couple of years ago in 2018 to really make sure that they had the core vocabulary people would need for really robust communication. And also we have a pain scale. We have a body where you can point to the part of your body that hurts. And we now also have a place where you can check off or write on the core board that you have a service animal and you need that service animal with you. And also to take into consideration before disaster strikes that you should be creating a support network. Caroline Phillips from the AAC program in Georgia has a lot of information on this. And you might want to even ensure that you have somebody who always knows about your AAC needs, knows about your backups and where they're stored, maybe has a set of your keys, knows where your go bag is, have all those people in your loop, have a network set up in your cell phone so that you can easily contact those people. And also there's a lot of stuff that you can do with smart home technology. So if you have a Amazon Echo, you can use a skill for the Amazon Echo called Ask My Buddy. And Ask My Buddy helps you to set up an emergency network. And so that when you enter your key phrase, you know, Alexa, ask my buddy to call so-and-so, then it's going to put you in contact with that emergency network or send at the very least a text message that says that those people need to check in and see where you are and see if you need help. I'm sorry to anybody whose Alexa I just set off in the background. But there are actually a number of apps or a number of skills that you can download for your Echo and use to make sure you stay in touch with your network. But also in terms of your local area, your city or local government, they often do maintain lists of people with disabilities, their particular needs, their communication abilities. And so contact your local emergency management organization and make sure that you're listed and make sure that first responders in your area know about your needs and know how to get in touch with you. Oh, I see somebody else in the Slack window, Laura, a friend of mine actually, she's lost power twice since the lockdown. Yes, again, things, don't they always say disasters come in threes? I really hope not. But yeah, you never know when that kind of thing is actually going to happen. Replacing damaged equipment. That's another thing that's important to keep in mind. If you are facing something like a hurricane, we know that people who are AT users in Puerto Rico really faced hardship after Hurricane Maria. And we know that people in Texas, after the other hurricanes that hit the same year in 2018, also faced a lot of hardship in terms of replacing their equipment. Well, there are organizations you can contact. So each AT Act program, such as TechOwl, has a reused and repurposed assistive tech program. And so we take donated equipment that's in good shape and we pass it on to people who need it in Pennsylvania. And the Pass It On Center, which is out of Georgia, they have a way for you to check on the ATAC program or the Reuse Center for any state or US territory. So check out that website and you can see where your local reuse program is located and how to get in touch with it. But also beyond Georgia, the AT3 Center, which is sort of the ATAC program technical assistance body, They have worked very hard along with USAC, the US Society for Augmentative and Alternative Communication, to develop device replacement programs when disasters have hit. So these are great organizations to know about. Join USAC, stay in touch with them, and should some kind of a disaster like a storm hit, they may be of help to you in figuring out what resources you have for replacing lost equipment. And then hopefully you've backed up your vocabulary set to the cloud, and bing, you just download it and you're good to go. And your person's motor programming is saved. Yet another huge readjustment because you're able to download their particular vocabulary right to that new device. Also, states and territories do have training plans. And in Pennsylvania, TechAL, as the ATAC program, worked closely with DHS and the local FEMA reps and others to develop training materials. They're at techalpa.org/learn/AFN course/. So that's AFN standing for access and functional needs. We've got a training which is not meant for us to give you. It's meant for disability awareness organizations, rights organizations to use and give to others. So we want people with disabilities speaking to first responders, speaking to local emergency response organizations, and helping them to raise their awareness of how to work with people with disabilities during any kind of a disaster. And I know a lot of you are going to be in different states, but you can take a look at what we have and sort of use it as a model for what might be useful in your local areas. And we have both a longer 3-hour training plus sort of a in the moment 15-minute need to know quick training on the website as well. Okay, further tips and thoughts as we wind up. Consider getting any benefits sent to you electronically because checks get stolen. And if you have to evacuate your house and be gone for a period of time, you may not know how long it's going to be. We don't want anybody's benefits checks stolen out of their mailbox. And also emergencies can disrupt the postal service. We've seen some disruptions in mail and other types of deliveries during COVID-19. So it's just wise to get your benefits taken care of electronically if you can. That way you have access to them even if you're not at home. Also, keep in mind service dogs. People need their service dogs with them in any type of evacuation. So have your paperwork for your service dog in your go bag. Make sure your emergency kit includes a go bag for your dog. Have food, have extra collar and leashes, extra scoop bags, have copies of your veterinary records and other supplies that you need. And authorities should not attempt to separate you from your service dog. But you know what? It's happened too many times to people I know. So make sure you're prepared and you have all that information that's necessary to prove that your service dog belongs with you and has the right to stay with you should you have to go someplace in case of an emergency. I think we've hit the sweet spot. It's 2:50. We're finishing right on time. I would be so happy to answer any questions that people might want to throw into the Slack channel. The slide that you see right now just has a list of the types of services that we have in Pennsylvania at TechAL PA. So we have the lending library. We do really great video demonstrations of equipment at this point. We have our reused equipment, but we also have a free special phone program. And that free special phone program includes smartphones. So if you have a low income, but you have the ability to get a basic data plan and you have a disability that makes it difficult for you to use a phone, you can apply to our free special phone program and you can get a few different types of equipment. We can get that into your hands. We're waiting on the funding to renew at the end of the fiscal year right now. And that can be a great thing to have as part of your emergency planning for whatever might lie ahead in the world that we're in right now. And in the end, I would like to dedicate this presentation today to my friend Julianne and her service dog, Johan, who passed away last weekend. He crossed the Rainbow Bridge. He was her guide dog for a number of years. And even though she has a new guide dog, it doesn't hurt any less. And he's going to be missed forever. So in memory of Johan. And thank you, everybody, for being here today and participating in this presentation, and for just thinking a little bit about what emergency prep can look like.
Thank you, Kathryn. What an excellent session. And we're sorry to hear about Johan's loss. That's a difficult thing to face, especially when you're so connected to someone who's been a help and support in your life. But thank you for sharing your resources and your ideas. And thanks to all who have attended this session. Kathryn has said that she will work on making her slides available. I know we've had a few people who've had a hard time reaching those, and that's okay. But she's going to have them on aaccommunity.net. And so if you'll keep an eye out there, you'll be able to find the slides for this session. And thanks to everyone who has attended, and we will move on to our next opportunity. Thank you, everyone. Have a great day.
And I see that somebody commented in the Slack channel that service dogs don't require paperwork, and they don't require paperwork. But my friend Julianne, in too many cases, when she's gone to a public library or tried to get on an Amtrak train, she'll have somebody stop her and say, "You can't take that dog in here." And she'll say, yes, under the ADA, I can take this dog in here, and you can't ask me why I use this dog. And they'll say, "No, but you can't bring this dog in here." And she'll say, "Well, I'm blind, I need this dog." And that person will often say, "But you're wearing glasses, you can't be blind." So even though you're not supposed to have that paperwork with you, too often, especially in an emergency situation, it can be handy just to have it with you anyway.
I think that's really good advice. Always better to be over prepared than not, even if you shouldn't have to. Anyway, thank you, everyone. Have a great afternoon, and we'll